Hi, I'm Dr. Aviva Romm, and this week we're going to talk about migraines. Why? Because they're awful, and if you struggle with them, you know that's true. You're not the only one, though. 36 million people are struggling with migraines, and check this out. They affect women 3 to 4 times more than men. The good news is you do not have to live with them. This video and article focus on migraines in general. If you have menstrual migraines, these steps will totally help you, but there are also other articles on my website that address hormone imbalances, and you might want to check those out too. It's important to know that migraines are not your fault. They're a complex combination of environmental, hormonal, and genetic factors, but there are things you can do to kick them out of your life for good. It's been amazing to me to see in my own medical practice something that conventional medicine says you just have to live with that can clear up completely with a natural approach. And so today, here are my top 6 steps for preventing migraines naturally. The first is to identify your migraine triggers using a migraine headache or a headache diary. And I've given you a link to one of those right here in the associated article that you can use. Common triggers include things like certain foods like red wine, aged meats, and deli meats because of the nitrates. Food sensitivities can trigger migraines, and so can allergens, anything that causes sinus congestion or exposure to strong odors like perfumes and detergents. The next thing to do is what's called an elimination diet. Now, there are articles over on my website for that, and my book, The Adrenal Thyroid Revolution, walks you through a 4-week elimination diet. And you don't have to wait to do the migraine journal. You could actually skip that step altogether, go right to the elimination diet, and that'll tell you what your triggers are. Step 3 may surprise you. It's to stop using common medications like Tylenol, ibuprofen, and even narcotics that can cause something called medication overuse headaches. Now, the migraine medications like the triptans don't actually cause those, but they have their own side effects. If you want to learn to treat your migraine pain or headache pain without those medications, I've got an article for you over on my website on treating pain naturally. Now, the next step is to get your digestion moving. I have seen so many women who struggle with constipation, and when they clear up their constipation, guess what? Their migraines clear up as well. So I've given you some links to articles on boosting your digestion, and check out the one on bitters because they're kind of an unknown herbal category. Not a lot of people know how to use them well, but they're amazing for getting your digestive system moving. But you can also do things like adding fiber, flaxseed, and other herbs to your lifestyle that help keep your bowels regular. Part of the secret sauce of migraine prevention is knowing which vitamins and herbs to use. And I'm going to give you my top 5 that have been shown scientifically to prevent migraines. The first is vitamin B2 or riboflavin, and 400 milligrams a day has been shown to reduce the frequency and intensity of migraines, and it can be used during pregnancy. The trick is to use it for at least a month before you decide whether it's working for you. It can be tremendously effective. The next is 600 milligrams a day of magnesium, which is especially helpful if you get migraines around your period. That can also be used safely during pregnancy. Now, the next 2, feverfew, which you take 25 milligrams a day, or butterbur, or also called petasites, you want to get what's called PA-free, 75 milligrams a day, are both fabulous anti-inflammatories that have been shown to prevent and also reduce migraines. Neither of those can be used during pregnancy, and the feverfew should not be used if you're on blood thinners. And finally, fish oil, another terrific anti-inflammatory, can prevent migraines at 1,500 milligrams a day, and it's safe to use during pregnancy. Now, you can use any of these separately, but I recommend really going for it. Use all of them together. Again, not if you're pregnant, skip the 2 that you can't use, and create a program for yourself where you're following the elimination diet, starting to identify your triggers, and adding in these supplements. And over a month or 2, you will start to notice, or you should start to notice, a pretty significant reduction in migraines. And I've even had patients completely eliminate migraines after years or decades of suffering with them. Now, you want to support all of this by being on an anti-inflammatory diet, which again, you can learn more about in the article below or connected with this video, and also in my book, The Adrenal Thyroid Revolution. And if this is valuable to you, if you really love living your life pharmaceutical free or not dependent on pharmaceuticals, there's some more things you can do. One, like this article, so I know that you came here and it was helpful for you. But also, before you leave, download a copy of my free gift for you, which is 25 ways to detox your medicine cabinet. You're going to find a whole lot of things that we think we need pharmaceuticals for that nature provides a really great, effective answer, and I use every day in my medical practice. Thanks for joining me today, and I hope you found this really helpful.